AstraZeneca announcing late-stage data shows its vaccine was, on average, 70% effective at preventing the virus. But that's not the whole story. Researchers say the trial looked at two different dosing regimens. Hear this. One was 90% effective when patients received a half dose, followed by a full dose at least a month later. The other was 62% effective when people got two full doses a month apart. Combined, the results showed an average efficacy rate of 70%. But think of it. If a half then a whole works, that's what they'll do. One footnote, the half dose was never supposed to happen in the first place. It was actually an error, one that turned out to be a very fortunate one. Meantime, a CDC committee met today to discuss vaccines. The conversation included side effects and how those should be communicated to the public. CNBC's Meg Terrell covers science and medicine for us. Meg, this new vaccine could be cheaper and easier to distribute. Is that right?
Yeah, that's right, Shep. It really could be. You know, Oxford and AstraZeneca, which are working on this vaccine together, they've established a price of less than $4 a dose, compared to closer to $15 or $20 for Pfizer and Moderna. And this vaccine doesn't have to be kept super cold, so it'll be simpler to distribute, particularly to rural areas. But it's not clear the vaccine will have an easy time getting through the FDA, at least with these results. They're from studies run in the UK and Brazil, and the FDA may want to see more data, especially from the U.S. trial. But the Pfizer and Moderna vaccines could be just a few weeks from the FDA's green light. Operation Warp Speed Chief Advisor Moncef Slaoui notes vaccines will start to be shipped within 24 hours of authorization, saying that under the most aggressive timeline, the first shots could be going in people's arms by December 12th. So then the question is, who gets those first doses? A CDC advisory group today outlined a proposal that puts healthcare workers, essential workers, adults with high-risk medical conditions, and the elderly first. Now, the government estimates there will be enough doses for 20 million people in December and then 25 to 30 million each month after that. Now, how soon people not in the priority groups can get vaccinated depends on more vaccines working and adding to supply. But of course, Dr. Anthony Fauci has said by spring or early summer, most Americans should have access, Shep.
Now, Meg, separately, the FDA granted emergency authorization for Regeneron, an antibody drug that was given to President Trump. So this to help you once you have it and not get so sick. How significant is this?
Yeah, it could be an important advance. You know, it's an antibody drug, as you said, made by Regeneron, and it was the first medicine the president was said to have received after he was diagnosed with COVID-19. So the drug here was cleared for people in that same situation for use as soon as possible after diagnosis, and it's specifically for people at high risk for severe disease. So those with obesity, chronic kidney disease, diabetes, or immunosuppressive disorders, those older than 65, and others in high-risk groups. And, Shep, that's because supply is constrained here, too. HHS Secretary Alex Azar said the government will have 30,000 doses to ship tomorrow. That's enough for 30,000 people. And Regeneron says it'll have enough for 80,000 people this month, 300,000 by the end of January. But given the numbers of people being diagnosed with COVID every day, that's not going to be enough.
No,
Shep.
Certainly not. Meg, thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.